Imagine a deadly lung infection, once thought to only target the most vulnerable, now silently creeping into the lives of our grandparents and those battling common cancers. Pneumocystis pneumonia, PCP, a fungal infection that can kill up to 60% of those it infects without HIV, is shifting its target, and that's a terrifying prospect. For decades, doctors believed they knew exactly who was at risk: patients on strong immune-suppressing drugs, often after organ transplants, or those with blood cancers like leukemia. These were the patients who received preventative medication. But here's where it gets controversial. Recent findings suggest that the old rules no longer apply. A comprehensive 7-year study from Taiwan, published in the Journal of Infection, has blown the lid off this assumption. Dr. Tingwei Cao and his team meticulously analyzed 470 non-HIV patients diagnosed with PCP across 7 major hospitals between 2016 and 2023. Their discoveries are challenging the very foundation of how we understand and prevent this deadly infection. The most alarming revelation? The risk profile for PCP is fundamentally changing. By 2023, a staggering 70% of PCP cases were occurring in patients not receiving the high-risk medications traditionally associated with the infection. This means a significant number of people are developing PCP without the factors doctors typically look for. We're seeing a fundamental change in the risk profile, the researchers emphasized, highlighting the urgent need for a reevaluation of current strategies. Elderly patients are particularly vulnerable. The study revealed that over 1/3 of PCP cases in those aged 85 and older involved individuals taking only medications not conventionally linked to the infection. Think about that. Seemingly harmless medications, combined with age, might be creating a perfect storm for this deadly fungus to thrive. And this is the part most people miss. It's not just about the medications, it's about the complex interplay of age and health. Furthermore, solid cancers, like lung, breast, or colon cancer, have now surpassed blood cancers as the most common underlying condition in PCP patients. This is a major shift. Even more concerning, nearly 1/3 of patients had no previously recognized risk factors at all. These individuals tended to be older and grapple with common health issues, such as high blood pressure, diabetes, and heart disease, conditions that are increasingly prevalent in our aging population. The study also shed light on the devastating outcomes associated with PCP. Patients with solid cancers face the grimmest prognosis, with hospital death rates exceeding 60%. Overall, half of all patients succumbed to the infection during hospitalization. The disease was severe across all groups, with over 60% requiring intensive care and 3/4 experiencing respiratory failure, often needing ventilators to breathe. Currently, prevention guidelines center around patients on specific high-risk medications. But this research strongly suggests that many vulnerable individuals are slipping through the cracks. The study uncovered significant variation in medication patterns across different diseases, suggesting that a one-size-fits-all approach to prevention simply isn't effective. Prevention strategies need to be more nuanced, tailored to specific diseases and individual patient profiles. The increasing number of cases in elderly patients with common health conditions points to a concerning trend. Aging itself, combined with everyday medical problems, may be creating a hidden vulnerability. As we age, our immune systems naturally weaken, potentially exacerbating subtle immune deficiencies that current risk assessment methods fail to detect. This raises a crucial question. Are we underestimating the role of age and common comorbidities in PCP risk? These findings have profound implications for how doctors approach patient care. Clinicians need to be more vigilant about the possibility of PCP in a broader range of patients, especially elderly individuals with solid cancers and multiple health conditions, even if they aren't on traditionally high-risk treatments. The researchers advocate for the development of more sophisticated risk assessment tools that consider age, overall health burden, and disease-specific factors beyond just medication exposure. Imagine a risk calculator that factors in age, blood pressure, diabetes, and even the type of cancer. That's the kind of targeted approach we need. As Professor Youngyin Qian, the corresponding author of the study, Aptly puts it, these evolving patterns suggest that current prophylaxis guidelines, which focus primarily on patients receiving established high-risk medications, may need reconsideration. We're missing a significant proportion of vulnerable patients, particularly those with solid cancers and elderly individuals with multiple comorbidities. He further emphasizes the urgent need for more targeted prophylaxis strategies that balance preventing this deadly infection against unnecessary antimicrobial exposure. In other words, we need to find a way to protect those at risk without overusing antibiotics, which can lead to antibiotic resistance, a growing global health threat. This study paints a stark picture, one that demands a serious reevaluation of our current PCP prevention strategies. Are we doing enough to protect our most vulnerable? Are current guidelines adequate in an aging population with increasingly complex health profiles? What new risk assessment tools should be developed and implemented? Share your thoughts and experiences in the comments below. Do you agree with the study's conclusions? What changes do you think are necessary? Let's start a conversation. Professor Youngin Qian's email address, email protected.